Well, my name's Kayla. I'm one of the pharmacy residents here, so thanks for coming. I know we have a small crowd today, but that's okay. There's still a lot to learn. So like I said, I'm a pharmacy resident here, and today I'm going to be presenting over-the-counter medications to treat your pain. So some objectives of this presentation are to know the differences between over-the-counter, which is abbreviated OTC, and prescription medications. Actually, I'll come over here. Also, learn how to read a drug facts label. This tool will be very useful to you when you are trying to determine active ingredients in different formulations. Also, review some recommended oral and topical agents for managing pain, and understand how to safely administer medications. So there are two classifications. We have prescription and we have OTC medications. And there's a reason why there's two different classifications. A prescription medication requires a written order from a physician, and these are bought at your pharmacy behind the counter from your pharmacist. Now, prescription medications can be used to treat some minor ailments, but they're also used to treat more serious illnesses and conditions as well. A prescription requires a medical diagnosis from a physician and should not be shared with anyone. Whereas an OTC, or over-the-counter medication, can be bought without a physician's order, and you can buy it at the pharmacy over the counter, so you don't need to go to see your pharmacist to purchase this, although you can to receive any OTC medications are used to treat minor ailments or conditions, and they typically rely on self-diagnosis, such as saying, I have a stomach ache or I have a headache. And over-the-counter medications can be used by more than one individual, whereas the prescription should only be used by the individual it is written for. Now, irregardless of the classification that the medication falls into, whether it's OTC or prescription, it's really important to know that any medication that you take can cause harm if you use too much of it or if it's used incorrectly. So it's very important to follow directions carefully and correctly every time. Have small children at home, make sure that your children are only using medications with permission from an adult. And pharmacists are always available to help answer questions that you may have, whether it's an OTC medication or a prescription. So when you go to the pharmacy and you're looking for a pain med, and you see this huge aisle of different pain medication options, how do you pick what is the most appropriate treatment? Well, that's the purpose of this presentation today, to help you pick out different types of medications from this big aisle and also understand what to look for in a drug facts label. So on the back of every over-the-counter medication is this drug facts label, and it has a lot of really useful information. So at the top, it's going to start with the drug facts, with the active ingredient, and this is the generic name of the medication. So here you see that the active ingredient is acetaminophen. This is the medication that is going to be used to treat the condition that you're taking it for. So beside the drug name, we'll also list the strength. It says acetaminophen 500 milligrams. That's a strength that's in each tablet or capsule. And then next to it is going to say its purpose, so why you are taking this. Acetaminophen is a pain reliever and also a fever reducer. Below the active ingredients, it's going to list its uses. So here it lists that acetaminophen temporarily relieves minor aches and pains due to the following conditions. Also going to list warnings below, and this is a really important section to look into. So acetaminophen here, you can see there's a warning for liver impairment. So there's also a warning for an allergy alert. So it's really important to make sure that you're reading these warnings before you're taking this medication to make sure that you are using this medication appropriately for any pre-existing condition you may have. On the right side, you'll see that there are some additional warnings for, let's say, pregnancy or breastfeeding, what to do if an overdose occurs, and also directions. So typically, over-the-counter medications will segregate directions based on adults and then for children. So this medication, acetaminophen, is the 500 milligram strength. They're the tablets. So it's formulated for adults. So it lists the adult directions. And then children under 12 years, it does say ask a doctor. There is acetaminophen available for pediatrics or infants, and those come in usually a liquid formulation. So on the back of that will be a weight-based table that you can refer to. So you would dose the patient based on their weight. The bottom is inactive ingredients, and those are any binders that we have to use to create a tablet or any coatings. They don't really play into the active ingredient, so it's really the active ingredient that you need to focus on when picking out a medication. Now that we know how to read a drug facts label, we'll go into some of the more common oral pain medications that you can take over the counter, with the first being acetaminophen, which we just discussed on the drug facts label. Acetaminophen is also known as Tylenol as the brand name. Like I said, acetaminophen is an analgesic, so it will help to relieve pain, and it's also an antipyretic, so it helps to reduce fever. Acetaminophen is indicated to temporarily relieve minor aches and pains, several different conditions. So you have the common cold, if you have a backache, if you have some arthritis or a muscle ache, and additionally also temporarily will reduce fever. The directions to use acetaminophen for adults and children that are over 12 years of age are to take 500 to 1,000 milligrams every 6 hours as needed. And for children that are less than 12 years old, you should be referring to a weight-based table that will be available on the back of the drug facts label. It's very important that you remember that there is a max daily dose for acetaminophen. The FDA has recommended that the max daily dose should not exceed 3,000 milligrams or 3 grams in a total of 24 hours. And that is because they have observed that severe liver damage can occur if you take more than 4,000 milligrams in 24 hours. Additionally, there's greater concern for liver damage if you're taking other drugs that contain acetaminophen. So there are several cough and cold drugs that may have acetaminophen in it, but doesn't really appear to be on the front part of the label. So that's why it's really important to be reading the back of the drug facts label, so that you can identify products that also contain acetaminophen so that you're not exceeding this max total daily dose. Severe liver damage can also occur if you consume 3 or more alcoholic drinks every day while using this product. So here are 2 different formulations of Tylenol. Now, remember that 3,000 milligrams is the max total dose. So how much of each of these can you take? How would you go about finding that out? Well, in the extra strength, you can see at the lower left-hand corner, there's 500 milligrams per tablet. So if there's 500 milligrams per tablet and your max dose is 3,000 milligrams, then the max is 6 tablets per day. On the other hand, the Tylenol regular strength has 325 milligrams per tablet, so the max dose would be 9 tablets per day. So always make sure you're looking at the dose for the different Tylenol products to make sure that you're not exceeding this total daily dose. There are several different formulations of acetaminophen available. We have our liquid formulations, which is typically what we use for our peds and infant population for ease of administration. There's an infant's formulation, and also comes in tablets. It can come in gel caps, which seem to have a faster release of medication, so a quicker relief of pain. And like I said, that acetaminophen can come in a lot of different cough and cold products, so such as this Tylenol cold sore throat. So it can contain other ingredients as well. Just make sure that you read the drug facts label. Now that we've covered acetaminophen, we'll move into some of another classification of drugs called our nonsteroidal anti-inflammatory drugs, also referred to as Nsaids, which you may hear me refer to this throughout the presentation. We have 3 categories of Nsaids available over the counter. The first being Aspirin, which comes as brand name Bayer, Bufferin, and it's also in Excedrin. We also have Naproxen, which brand name is Aleve. We also have Ibuprofen, which the brand name is Advil and Motrin. So Nsaids work through a unique mechanism of action. They are nonsteroidal anti-inflammatory drugs. So they differ from acetaminophen in that they have this anti-inflammatory property. So they help to decrease inflammation, and by decreasing inflammation, they'll help to relieve pain. Like acetaminophen, they're also indicated to temporarily reduce fever. So Nsaids block enzymes in the body that will produce signals to, or make chemicals to signal pain. And then when these enzymes are blocked by Nsaids, you'll feel less pain overall. Nsaids are indicated to temporarily relieve minor aches and pains due to conditions such as a headache, a muscle ache, toothache, backache, common cold, or menstrual cramps. Now, there are some warnings and side effects associated with the use of Nsaids that are really important to take away from this. Some common side effects that you may experience if you take an Nsaid include things like stomach upset or nausea, stomach pain, heartburn, or diarrhea. And that's because Nsaids are really hard on the stomach. So if you are taking something like Ibuprofen or Naproxen, you should always be taking this with some type of food or milk to help decrease that side effect. Some less common side effects of Nsaids include increasing blood pressure. Also, they can cause an allergic reaction. So if you have an allergy to aspirin, you should not be taking an Nsaid at all, because they can all cross-react and cause conditions such as hives, facial swelling, asthma, or wheezing. Due to the irritation from Nsaids on the stomach, there is a risk of stomach ulcers and bleeding. And this risk is increased if you fall under any of these categories. So if you're greater than 60 years of age, if you take any blood thinner, so such as warfarin or some of our newer oral anticoagulants such as Eliquis or Xarelto or Pradaxa, or if you take a steroid drug, so something like prednisone, if you consume 3 or more alcoholic drinks per day, if you have had a history of stomach ulcers or bleeding problems in the past, or if you're taking more Nsaids than prescribed, or if you're taking them longer than that's been allowed. So in addition, there are some concerns that Nsaids can damage the kidneys, and these risk factors include patients over the age of 65, and that's because through aging, the kidneys start to lose some of their function. So if you throw on a lot of Nsaids, then it can further damage the kidneys. Also, if you have poorly controlled high blood pressure or volume depletion, and so some things that might cause volume depletion include agents such as diuretics, if you're dehydrated, so you don't consume enough water at home, or if you have liver disease, because these are metabolized or they're broken down through the liver. Also, if you use a drug such as an ACE inhibitor, and an example of an ACE inhibitor would be a drug called lisinopril. There's also fosinapril. Anything that really ends in pril is an ACE inhibitor. Or an ARB, so something like losartan or candesartan. Anything that ends in sartan is an ARB. Nsaids can also increase sodium retention, leading to fluid overload. So if you've ever consumed a large amount of salt, you might notice that maybe your hands are a little bit swollen. Well, Nsaids kind of do the same thing. They cause sodium retention, and this causes fluid overload. So this can be dangerous if you have a condition such as congestive heart failure, because congestive heart failure and taking Nsaids can lead to an exacerbation of CHF. And so some signs of a CHF exacerbation could be something like you notice swelling or edema in your legs or your feet. Lay down at night and you feel that you need more than one pillow to sleep at night. That could be a sign that you are volume overloaded. If you notice that there's increased fatigue or shortness of breath while doing simple physical activities such as walking. And then a good rule of thumb to follow when you have congestive heart failure and you're worried about maybe an exacerbation is to take your weight daily by stepping on a scale and measuring if you have gained a couple of pounds, as that might be a sign that you have volume overload. So also just keep in mind that there are exceptions for patients who are taking aspirin for heart protection because of that benefit to risk ratio that your physician will can discuss with you if you are concerned about that. But there are exceptions if you do take an aspirin for heart protection. So based on all of those side effects and concerns that we just discussed, there are some patients who should not be taking Nsaids. And this list includes patients with known kidney disease, and as I just mentioned, because it can cause kidney damage. If you have known liver disease, like I said, if you have an allergy to aspirin, if you have active peptic ulcer disease, because as I mentioned, they can be very hard on the stomach. If you have bleeding problems, because Nsaids can cause worsening of any bleeding problems, especially if they cause an ulcer in your stomach. If you take any medications to thin the blood, as I mentioned, something like warfarin, which is the brand name Coumadin. If you have high blood pressure that's difficult to control, congestive heart failure due to the risk of exacerbations. Pregnant patients in their 3rd trimester should not take Nsaids. If you consume 3 or more alcoholic beverages per day. And then those who have an upcoming surgical procedure, such as a dental surgery, you should always check with your physician maybe about a week before your procedure to check if they would like you to stop taking your Nsaid because of the risk of bleeding. Typically, if they do want you to stop taking it, it might be around 5 days. But always check with them because in most cases it'll be okay, but some of them really might want you to stop taking that. And to prevent having to reschedule your surgery, then it might be a good idea to just check to see if you should stop taking your Nsaid. So aspirin is available over the counter as 3 different strengths. You have an 81 milligram strength that's usually used for heart protection. You have the 325 milligram strength, which is our enteric-coated formulation. And it also comes as an extra strength formulation as 500 milligrams. The directions for use are to drink a full glass of water with each dose. And for adults, you should take 1 to 2 of the 325 milligram tablets every 4 hours as needed, but make sure that you do not exceed 12 tablets in 24 hours. It's very important that we do not give aspirin to children because there is a risk for a condition called Reye's syndrome, which can be very dangerous, especially if the child has a viral illness. This can present with brain, kidney, or liver damage. So we should only be using aspirin in our adult population. So some downfalls to aspirin is that it does have a delayed action, so it really doesn't provide pain relief very quickly. Also, aspirin, if you are already aware that it can cause anticoagulant effects, so it can kind of thin the blood a little bit. So not typically the first choice Nsaid that we go to for treating pain because of this additional risk of bleeding. So aspirin comes in a lot of different formulations similar to acetaminophen. We have Bayer, that's one of the brands, and Excedrin does contain aspirin. It comes as a generic in tablet form, and there are some different formulations of Excedrin. At the top here we have Excedrin Migraine. At the bottom we have Excedrin Extra Strength. So you might wonder what's the difference between those two, but if you look on the drug facts label, you'll see that the drug strength might be different. So always be aware of that. Now we'll move on to Ibuprofen, which brand name is Motrin or Advil. It's available over the counter in a 200 milligram strength. The directions for use for adults and children over 12 years of age are to take 1 to 2 tablets every 4 to 6 hours as needed for pain, and do not exceed 6 tablets in 24 hours, as that is the maximum dose. For children less than 12 years old, you should refer to the package labeling for a weight-based table. And ibuprofen is safe to use for children that are over the age of 6 months. So ibuprofen comes in a couple different formulations. We have a children's liquid formulation. We also have tablets, and then there's even a PM formulation that contains an extra ingredient for helping you to sleep. In this case, it's diphenhydramine, which is also known as Benadryl. But the most commonly referred brand names are Motrin and Advil, so just be aware of that. Now the last Nsaid that we'll talk about is Naproxen, which brand name is Aleve. It's available over the counter in a 220 milligram strength. And the directions for use are to drink a full glass of water with each dose. For adults and children over the age of 12, take 1 tablet every 8 to 12 hours as needed. For the first dose, you can actually increase this to 2 tablets within the first hour, but make sure that you don't exceed the max total dose in 24 hours of 3 tablets. And Naproxen is not recommended for children under the age of 2. So Naproxen is actually has a longer duration of action than our Ibuprofen or Aspirin, so it does last longer. So it may be beneficial to you if you're looking to take something twice a day versus something every 4 to 6 hours. So Naproxen comes in a couple different formulations as well. We have Aleve liquid gels. We have the standard Naproxen tablets. There's even this Naproxen that's brand name Motramax, which don't confuse with Motrin, which is ibuprofen. That can be tricky based on the labeling. Always make sure that you're reading the back. Okay, so we've covered the most common oral pain medications that are available over the counter, and now we'll talk about some topical agents that you can use as well. Capsaicin is a very interesting agent. If anybody's ever tried it, you probably won't forget it. It's a heating agent, so it kind of causes a little bit of burning sensation. So first, it stimulates pain, and then it decreases the intensity of pain signals in the body over time, so you really don't feel the full benefit until after at least a couple of uses. It's indicated for the temporary relief of minor pain that can be associated with conditions such as arthritis, a backache, any muscle strains, sprains, or bruises. And capsaicin is only approved for adults over the age of 18, and also it's for external use only. Should not be using capsaicin within an hour of taking a shower or bath, or before or after, because of the heating effect that hot water can also provide. So I included a picture of a chili pepper here because capsaicin is actually derived from chili peppers. So it comes in 2 different forms. It comes in a cream or a patch. For the cream, you can apply to the affected area not more than 3 to 4 times daily, making sure that you're massaging it into the area. And a good tip here is to use gloves when you're applying this, because it's not only going to absorb into the site that you're rubbing it into, but it's also going to absorb into your hand. Even if you wash your hands immediately after use, you'll still have some residue. Okay, and so for the patch, you should be cleaning and drying the affected area before use. There is a film on the patch, so make sure that you remove that. Apply it to the affected area. You can do up to 3 to 4 times daily, and they say for 7 days for maximum benefit. And you should not keep this patch on your skin for more than 8 hours at a time. So because of the heating effects associated with capsaicin, it's important that you do not put any bandage over the top of the cream. Also, don't use a heating pad, and don't apply it to any open wounds, damaged skin, or even exposed to direct sunlight. It's recommended that if you have a worsening condition, if your symptoms seem to persist for more than 7 days, or if they seem to clear up and then come back again, then you should be consulting your physician for maybe an alternative option. Also, if you notice that a lot of redness is starting to develop, or if it becomes very irritated, then you should stop use of capsaicin. So as I mentioned, capsaicin is available in a cream as well as a patch, and there's also this no-mess applicator, which I think might help to avoid that application to your hands. So we have the Capsaicin Patch on the top, and we also have the Salon Pause Patch on the bottom, which does provide capsaicin as well as another ingredient, which we'll talk about next. This is camphor and menthol. So opposite from capsaicin, camphor and menthol provide a cooling effect. So they are counter irritants on the skin. They produce a cool sensation, and they numb the nerve endings through mild local anesthetic effects. They're indicated to temporarily relieve pain due to conditions such as rheumatoid arthritis, muscle aches, arthritis, and also backaches. So camphor and menthol is approved for adults and children 10 years of age and older. Similarly to capsaicin, it is only to be used externally, and it should never be used on irritated, broken skin, or near the eyes or any mucous membranes, or on a large area of the body. They should really be only used on a localized area. So the directions for use are to apply it to the affected area not more than 3 times a day, and they recommend that for max benefit, you should be using this daily for at least 2 weeks to feel the full effects. So there are several different formulations available. There's something called Joint Flex, which contains camphor. You have little tins that do contain it as well. And then they also come in tubes with ointments or creams. We'll also discuss the differences between a heat and a cold pack. You'll want to know the differences and when to use which either heat or cold for a certain condition. So heat will increase blood flow to a particular area, and this will help to relax muscles and also to promote healing. So some instances where we might want to use heat includes things such as neck spasms, so if you're having any muscle tightening in your neck, also arthritis, it'll help to loosen up, and backaches as well. So Thermacare provides heat wraps, and they provide a lot of different types of wraps where you can put them on different areas of the body. Now, cold will do the opposite of heat in that it decreases blood flow to the area, and it will help to decrease any inflammation and swelling. So you should be using cold packs for anything like a sports injury, so if you happen to twist your ankle or any of that sort. Also migraines, cold is recommended, and any gout flares you may have. Similarly to heat wraps, they come in a lot of different sizes and shapes to apply to the appropriate area. So if you have any medications that require measuring, let's say you have a child and you have to give them some acetaminophen and it requires you to drop a certain amount of a dose, it's really recommended that you're using the measuring tool that comes with that product. So we have spoons, cups, or syringes that we can use as measuring tools. And in the case that your medication maybe doesn't come with one or you happen to misplace it, know that you can always go to your local pharmacy to receive one of these products. They do contain measuring tools behind the counter. Also be aware that a silverware spoon really is not the greatest method for measuring, and that's because they come in so many different shapes and sizes that you really can't guarantee the appropriate amount by just using a silverware spoon. So if you've been using this method, I recommend you to stop using this method and instead use one of the measuring tools for medication specifically. So now we'll go through some examples of some differences between pain meds and when it's appropriate to take both pain meds together and when it's not appropriate. So here's an example. Jane has a sore throat. Should she take these 2 products together? So on the left here we have NyQuil, cold and flu. And on the right here we have Tylenol extra strength. So anybody think that these are okay to be taken together? How would we go about knowing? Okay, I think that's a great idea. So we can look on the drug facts label on the back. So I know it's kind of difficult to read, but you can see that NyQuil has acetaminophen 325 milligrams in each capsule, as well as some other ingredients listed below it in yellow. And Tylenol also contains acetaminophen 500 milligrams. So Jane has a sore throat. She does not need to take both of these because they each contain acetaminophen for pain. Okay? Okay, now we'll move on to Bob. Bob has a sinus headache. Should he be taking these 2 products together? Here we have Advil, cold and sinus, and here we have plain Aleve. So here we can also look on the drug facts label. And again, I know it is small and difficult to read, but Advil cold and sinus contains Ibuprofen as the generic ingredient, and Aleve contains Naproxen. Anybody think that these are okay to take together? Okay, so ibuprofen and naproxen, although they are different drugs, they fall into the same class of drugs of being an NSAID, a nonsteroidal anti-inflammatory drug. So no, he does not need to take both of these drugs because they are going to be doing the same thing even though they are different drugs. So another example, Gary has congestion and he also has a sore back. Can he take these two products together? Here we have Mucinex, which is Sinus Max, and we also have Motrin, which is ibuprofen. So in the Mucinex, it contains acetaminophen, it contains guaifenesin, and phenylephrine. So just pay attention to the first ingredient. So it contains acetaminophen, and Motrin contains ibuprofen. So are these the same drugs? So they're not the same drug, and they're also not in the same class. So it is okay if he were to take these together. However, what I would recommend to Gary is that he has congestion and a sore back. Why doesn't he just try the Mucinex, which does have acetaminophen in it already, which can be used to treat his pain that he has also. And maybe in a couple of hours, if he's still experiencing back pain, then he can go ahead and take his ibuprofen. But these can be taken together safely because they don't fall in the same class. Okay, so now Jill has a sore back. Should she use these two products together? Here we have a Capsaicin Patch and also a heating pad. Should she be using these two products together? Good job. So no, never use a heating pad on top of a Capsaicin Patch unless you want to be in excruciating pain. Okay, so now we'll walk through some other examples of some over-the-counter medications to pick out which of these do not contain an NSAID. So at the top left, we have ibuprofen, cold and sinus. Is ibuprofen an NSAID? So yes, ibuprofen is an NSAID. How about Aleve D? Aleve contains naproxen. Yes, that's also an NSAID. Alka-Seltzer Plus contains aspirin. Aspirin is an NSAID. Okay, so, yep. How about the Sudafed Sinus Advance? The top right of the box, you can see what it contains. Yep, with ibuprofen, yes. So ibuprofen is an NSAID. Now, Dayquil contains acetaminophen. Correct. So acetaminophen is not an NSAID, so that's the correct answer. So just be aware of that all of these products, you really have to look at the active ingredients to pick out which falls into that category. Okay, and to complicate matters even worse, all of these products are Midol. If you haven't heard of Midol, it's used typically to treat premenstrual or menstrual cramps. And Midol makes a lot of different formulations of products. So here we have Midol Complete, and it contains acetaminophen. And then we have Midol liquid gels on the bottom, which contains ibuprofen. And then here at the top, we have another Midol Complete. And you can see under 16 caplets, it says with acetaminophen. And then here at the bottom right, we have Midol Extended Relief, which contains naproxen. So just be aware that if you want to send your husband or whoever to go pick up some Midol, just be aware that he might come home with 5 different formulations, all containing different ingredients. So make sure that you are specific in the type of drug that you need. So as always, it's very important that we store our medications in a safe location, whether they're prescription or over-the-counter. A lot of the medications made are formulated to taste good, especially for our pediatric population. So they'll taste like bubblegum, they'll taste like grape or cherry, and a good amount of our peds population might think they're gross, but some of them actually think that they taste really good and might even think they taste like candy. So For this reason, you need to make sure that you always keep medications out of the reach of children and also out of the reach of pets. You should be calling the Poison Control Center for help if someone happens to take too much of a medication or if they take the wrong medication. Very good resource to use. So, some takeaway points. Just remember that just because it's over the counter doesn't mean that it's necessarily safe to use. Make sure that you're always reading the drug facts label and looking at the section called Active Ingredients. Making sure that you're following instructions appropriately, never take more than what's been directed, and also never take more than what's recommended by your pharmacist or doctor. Make sure that you use appropriate measuring devices if your medication requires one of these devices, and also keep medications out of the reach of children and pets. And as always, pharmacists are available at the pharmacy to help you select a product or answer any questions that you might have about your meds. So with that, do you have any questions? Okay. Mind if I ask what you currently take? Oh, you don't take anything? Wow. Okay. What have you tried in the past? Did you learn that the hard way? I think most people do. Okay. Well, welcome.